There is a statement that many people with peripheral neuropathy hear at some point. It's not said loudly, it's not said cruelly. Sometimes it's even said gently or even kindly. But once it's said, something changes. There's nothing else we can do. For a lot of people, that sentence does not just end treatment. It ends momentum, it ends curiosity, and it ends hope. And because it comes from a person in authority, most people, they accept it as a fact. But here is what almost no one takes the time to explain. That sentence usually does not mean the body has reached its limits. It means the approach being used has approached or reached its limits. Those two are two very different things. Medicine, as most people experience it, it feels absolute. You either have an answer or you do not. You either have a treatment or you do not. You're either fixable or you're not. But real biology does not work that way. Every form of care operates within a model. A model decides what gets measured, a model decides what gets treated, and a model decides what gets ignored. And when results stop showing up, the model rarely questions itself. It concludes the patient is out of options. That is not the same thing as the body being out of potential. In neuropathy care, most conventional approaches operate inside of a system-focused model. The priority is sensation, pain, burning, tingling, numbness, so the tools are aimed there. Medications are used to quiet the nerve signal, injections are used to dampen irritation, and devices are used to interrupt perception. And early on, this can look like progress. Symptoms tend to soften, sleep will improve, and the patient feels a bit of relief. That reinforces confidence inside of that model. But over time, something predictable happens. The relief shows, then it plateaus, then it quietly fades, and eventually the patient hears the sentence, "We've tried everything." What that actually means is this: we have used every tool available inside of this framework. It does not mean the nervous system has been rebuilt. It does not mean the environment supporting the nerves have improved. It does not mean the conditions required for repair are present. It simply means symptom control has reached its ceiling. This is where clarity matters. Nerves do not fail because they are weak. They fail when the systems that support them are under strain. Blood flow, oxygen delivery, metabolic stability, inflammatory burden, mechanical stress, signal efficiency. When those systems are compromised, nerve tissue adapts downwards. You can quiet pain for a period of time, but you cannot override physiology forever. So when someone is told there is nothing else that can be done, what they are really being told is this: within this model, we do not have another lever to pull. That is not a final statement about biology, it's a boundary of the approach. This is why two people with the same diagnosis can have completely different outcomes. One is managed, the other is rebuilt. One receives care aimed at sensation, the other receives care aimed at systems. And this is also why so many people are told their neuropathy is idiopathic. When a model cannot explain the cause, the label shifts. But idiopathic does not mean random. It means the framework stopped short. Now, let me be very clear. I'm not saying every case can be reversed. That would be dishonest. But I am saying this: Many people are told they are out of options far earlier than biology would agree. Because biology does not operate on appointment schedules or prescription pathways. It operates on inputs. Change the inputs, change the environment, change the range of possible outcomes. This is where system-based care becomes fundamentally different. Instead of asking, how do we quiet symptoms? The question becomes, what is preventing repair? That shift changes everything. It changes timelines, it changes expectations, it changes how progress is measured, and most importantly, it removes false finality. Because once a person believes nothing else can be done, exploration just stops. Final statements are dangerous when they're built on incomplete models. Neuropathy is not a switch that flips overnight. It is the result of pressure accumulating across systems over time. And pressure can often be reduced. Not instantly, not aggressively, and not with guarantees, but far more often than people are told. So when you hear, there's nothing else we can do, pause before accepting it. Ask a better question. Nothing else within which model? Because that question is where real care begins.